My name is Denise Lyons, and I'm a nurse practitioner in Newcastle, New South Wales. My various roles, well, I've been a nurse practitioner since 2012. I started my career as a nursing assistant, and then I moved on to being an enrolled nurse, and then a registered nurse, and then a nurse practitioner. I've moved through those various roles because at every step along the way, I've just always wanted to do more to improve the health of the community. And I found the more education that I got, the more I could help. I grew up in the United States, and my initial nursing training was there in the United States. And my first job when I finished university was at a children's hospital in Washington, D.C. I really, really loved working with children and spent most of my 20s moving around the United States as a traveling nurse, working in all kinds of different pediatric contexts, everywhere from Los Angeles Children's Hospital to a tiny hospital on the Navajo Indian Reservation in Arizona. Working in those different contexts with children also led me to work at a summer camp for children with special needs, which is where I met my Australian lifeguard husband at the time. And that's what really got me interested in exploring working in nursing in Australia. COVID was such an interesting time. It was so challenging, but also so many opportunities came about for primary care nurses. I had the opportunity to travel to the Torres Strait and work with the public health team up there during COVID. It was an amazing experience for me personally to be able to learn more about a culture that I knew very little about before I lived and worked up there. The work that we were doing was initially trying to keep COVID out of the Torres Strait. So we were interviewing people who would return to the Torres Strait who had traveled kind of outside of the quarantine areas. And we were just tracking people's travels and trying to prevent COVID from coming in. Eventually, it did come into the Torres Strait, as it did to the rest of rural and remote Australia eventually. So then we were working really hard to spread the vaccine to as many places. So we ended up traveling to each of the islands in the Torres Strait to run immunization clinics offering the COVID vaccine to protect the population, really vulnerable population up there. It was so interesting and so rewarding. The newest role that I've undertaken is president of the Australian Primary Care Nurses Association, which represents the 98,000 nurses who are working in primary care. That is any environment really outside the hospital. So we've got primary care nurses working in schools, prisons, general practices, Aboriginal medical services, and just a whole range of environments outside hospitals. I really enjoy working in primary care environments because it allows us to focus on patient education and prevention of illness and injuries. The main things that we are advocating for is undergraduate nursing curriculums to include primary care content. So we want nurses who are learning to be nurses to understand the context of primary care and to develop the skills that are necessary in primary care nursing. And then following on from that, we're advocating for training places so that nurses don't just train in the hospital, but they also have the opportunity to experience nursing outside the hospital, in community, and in all those primary care settings that I talked about earlier. The other thing we're advocating for is greater recognition of the scope of practice, the skills and capabilities of nursing. We would like to see changes in the way that primary care is funded in Australia so that it would enable greater utilization of the whole team that works in primary care. This includes nurses and other allied health providers. So right now, the way primary care is funded in Australia is very much in a fee for service. You see your GP and then Medicare pays for that patient to GP interaction. But very often you might go to a general practice, for example, and you might see a nurse. She might give you your vaccination. She might dress your wounds. She might do an assessment, measure your vital signs, have a listen to your chest. Well, all of these things are not funded appropriately to enable the full scope of practice of nurses to be recognized. That's just one example. We do have some evidence to support the underutilization of nurses. We do a workforce survey every year of nurses working in primary care, and around 30% of them report to us that they don't feel they're working to their full scope of practice. So I guess the key message is we just want to do more, and we want to be recognized and valued for the work that we do. We've recently joined with other peak nursing organizations to highlight primary care nursing under a campaign we called Nurses Are the Solution. So we really do believe that primary care nurses have a lot of potential to improve the health and well-being of our community. Primary care nurses are working alongside people to enable and empower them on their healthcare journey. That's been exciting. The challenge has been getting recognition for the capabilities and the scope of practice of primary care nurses. For example, there's a workforce now in Australia, nurse practitioners, and really that role is not very well understood by the general public because it's an emerging role in Australia. So nurse practitioners are nurses who have done additional training to a master's degree level, who can diagnose patients and prescribe medications and order investigations and really manage the whole patient consultation independently. This is a role that's been really well recognized in the UK and in Canada and the United States, but it's pretty new here. There's about 3,000 nurse practitioners in Australia at the moment, and that workforce is growing. So that's exciting to see. It is, I think, incumbent on all of us to really promote the understanding of the capacity of nurses at every level, from enrolled nurse to registered nurse to nurse practitioner, to work with patients, to enable patients, and to improve health outcomes. So the advice that I would give to nurses who are interested in working in primary care are to, first of all, join APNA, because APNA provides a great opportunity for networking. Often in primary care settings, you're working in alone. You might be the only primary care nurse in that setting, or you might be in a team. But APNA provides a number of opportunities for great support. We have a transition to practice program. There is a student nurse placement program, and these are all ways that people can get great support for that moving to work in primary care. I would also encourage just ongoing education and learning for any nurse, really. But if you're moving into primary care, I think it's really important to understand concepts around chronic disease management, because that's what we're seeing. The population is aging. We know that more and more people are alive with chronic diseases, and we can keep them well and out of hospital through support and coaching. So I think understanding health coaching, chronic disease management, motivational interviewing are really important concepts. I think the other advice that I would give would be to just try to keep the passion alive. Primary care nursing is wonderful. We get to develop lifelong relationships with our patients. It's really from cradle to grave work, and that rewards that come from walking alongside patients on their journey is incredible, really. I hope it comes through the passion that I have for primary care nursing. It's a great career, and it can take you anywhere in the world. There are nurses making a huge difference in communities all over the globe through primary care nursing. So it's a great way to have an impact. I feel like my work, I work still as a nurse practitioner in general practice, and that helps me to have an impact on an individual level. But I feel like the work that I'm doing with APNA helps me to have an impact on a more systemic policy level. And I hope that's going to help to move nursing forward and to realize the profession for all that it can be. I think leadership comes quite naturally to people who believe in the value of what they do. And I think that's not uncommon for nurses. I think that we understand the impact we can have both on individuals and on communities. So my advice to emerging leaders would be to really believe in what you do, and don't be afraid to tell people proudly about what you do. I've heard people say, I'm just a nurse. Well, I don't like to hear that, because you're not just a nurse. Proud, I'm a nurse, and I have an impact. I have an impact on the health of my community. I help keep people out of hospital. I accompany people on their journey. I enable them with information. I help navigate a complex health system. These are such important things. And although the work is sometimes hard to measure on an individual level, we know what we do. And I think a part of leadership is just being able to be proud of that and to be able to tell the stories of the difference that you've made. Have patients tell the stories of the difference that you've made. I think there would be a rare person who hasn't been in a hospital or spent some time with a nurse outside the hospital who wouldn't say that that has had an impact on their health and well-being. Well, outside of work, my husband and I volunteer for Guide Dogs Australia, and we raise guide dog puppies. So anybody who's ever raised a puppy knows that they are little rascals. So Guide Dogs looks for people to take the puppies from when they are weaned up until they're about 12 months old, and just give them some socialization skills, some manners. So we enjoy doing that. It's sometimes hard to say goodbye to the pups, but we enjoy the limited time we get with them before they go on to do their important work. Some of them become guide dogs, some of them become companion animals, but at the end of the day, we get to be part of their formative years, and hope that they, whatever career those pups choose, is helpful to the community. So I guess in some ways, I never stop trying to help improve the health and well-being of the community. That's what I believe in.